Hi, everyone. I'm Scott Johnson, Senior Manager of Community at Blue Circle Health, and I'm here excited to be talking with Dr. Korey Hood.
Hi, everybody. Korey Hood. I'm a psychologist and professor. I work at Stanford University and also part of the Diabetes Wise team. And so excited to chat with Scott a little bit about all the things that we're doing at Diabetes Wise, but all the amazing things you guys are doing at Blue Circle Health.
Yeah, thank you. It's really a privilege to be here, and we're talking about like how do we get just better care to more people living with type 1 diabetes. And one of the things that I love about Diabetes Wise is I often feel very overwhelmed by all the options and choices and like the technology field in diabetes changes quickly, and I struggle to keep on top of it. And that's one of the great things about Diabetes Wise. Can you tell us a little bit more about what Diabetes Wise is all about and what you're working on there?
Yeah, happy to do that. It's exactly that. I think that when we first started, it was thinking about all the information that people have, especially, I mean, right after diagnosis, we all know that
Yeah,
it's like a crazy time
yeah,
of, you're really just in survival mode and
yeah.
just trying to understand what's available. And then as you go along, as you said, the field changes so rapidly, there's so
Mhm.
many new things that we wanted a place where people could see the whole landscape
Yeah.
and then us in our own way kind of help guide them toward what might be the best fit for them,
Hmm.
and we do it in a hopefully like unbiased way,
Hmm.
and it's unbranded. We're not funded by any of the device companies. We have support from the Helmsley Charitable Trust to do this, and so the idea is that we give people education and information. We give them options. We give them, hopefully, can help inform their choice.
Hmm.
And then we give them some tools to talk to their healthcare providers
Yeah.
about, hey, I'd like to try this. I'd like to do this. And so that's really been the focus. And then the other thing I'd add is that in the last year, we've added a lot of content around exercise and physical
Yeah.
activity. And that's been such a huge help because, I mean, as you know, both of us with
Live
type
with,
1
yeah.
diabetes, it's like, eating and moving are like
Yeah.
the hardest things to figure out. And
Yeah.
so if we can help people better understand and have better guidance on that, that's what we're trying to do.
Yeah, I really love that. I think I've heard a lot of stories about and experienced it myself about going into my endocrinology's office or my whatever my healthcare professional's office is and talking about wanting to move maybe to pump therapy or get a CGM. And I'm just given a recommendation for a device. And before I did any research, I didn't even know there were options for me, right? So I think that having such a good way to know that there are options and that some options may work better than others, it's really important for us.
Yeah, I think so. And I think that the other thing that happens is that, um, you know, even though there's so much information available to people or online, they still often look to their healthcare providers
Yeah,
as for the guidance. And I think a lot of times the healthcare providers are in this position of like, I don't want to say one versus the other. And even though they may have like opinions
sure.
on it, and that often doesn't help.
Yeah.
In that
Hmm.
situation, you kind of want the provider, and I know that experience too. Like, just tell me what you think is best.
Yeah.
And I think sometimes they're a little reluctant to do that.
Yeah.
Tell me a little bit about the things you're working on at Blue Circle Health, and then maybe more broadly at Blue Circle Health, because it's an
Yeah.
amazing organization.
Yeah. Thank you. So Blue Circle Health, it's a short-term program that offers clinical care, support, and education for people living with type 1 diabetes, for adults living with type 1 diabetes specifically. And it's a nonprofit organization, completely philanthropically funded. So everything that we do is no cost to people that come into the program. And um, we know that 6 months is a short period of time. Our diabetes doesn't go away
Yeah,
after six
yeah,
months, but our hope is that during that short time, we can help equip and educate and kind of uplift people so that they can learn how to better navigate their healthcare system that they're walking in every day. We also help them learn how to integrate and work closer with the healthcare system that they're in. My role specifically in that program is focused on community and how important it is for people living with type 1 diabetes to be exposed or at least aware of the ability to connect with other people living with type 1 diabetes.
So
No,
important.
for me, it's been
Yeah.
a huge part of me feeling like I'm living pretty well with diabetes. It's um, knowing that there's other people out there that struggle with the same things that I do. And, I kind of chuckled when you mentioned the exercise and activity part. Just yesterday morning, I had breakfast here at the convention, and it was a bit of a walk to get back, and I knew that, so I reduced my
Yep.
mealtime bolus a little bit, but I still had a low, right? And so it's like, okay, and I think that with the evolution of technology, some of those approaches that we're taking to adjust our therapy, they're changing along with the technology.
Yeah.
And so I'm thrilled that you guys are offering those insights
Yeah.
and lessons.
And I think to add on to that, I think, the part of the idea is to leverage what a lot of people are doing for
Mhm.
technology. And I think you guys are doing that too, with the CGM, taking it, and it doesn't just become like information for them to be able to say like my time in range is this.
Yeah.
It's information to guide the next step, and you have to
Mhm.
teach this kind of problem solving. And for us too, I've had so many of those situations where you don't really anticipate how long the walk might be, or
Right.
like the heat or whatever it is.
Mhm.
And then and so there's this problem solving that has to come along with it.
Yeah.
And so the tools are great. We want people to be on the latest and greatest tools, but they still need this extra support and guidance
Mhm.
and routine.
Yeah. I think there's also an important element of you hear how things are supposed to work, and then by tying into the community, you get a little more like life on the streets.
Yeah.
This is how, like, yes, it does work how it's supposed to work, but there are some nuances there.
Yeah.
It's an important part, and you guys have a community element to diabetes wise as well, right?
Yeah, we do. And like you said, the community is just such an important part of it. And I mean, we go back, 20 years going to
Yeah.
different kinds of events and spending time together and talking about things after sessions. And,
Mhm.
and, you build this community of people that, you don't always have to say the specific things that are happening. Sometimes it's helpful, but, you don't have to explain in depth the experience. You just say,
Mhm.
I have a low,
Yeah.
and so I think that the community part, especially around devices, what we found is that people share a lot about everything, but particularly around devices, the annoyances, the things that, okay, this is always going off. There's always an alert. My infusion set is falling off. Like, all of those things are really important because they're just true stories,
Yeah.
and people then can connect with it. But also, there's often this part of it that is problem solving.
Yes.
What are we going to do about it?
Mhm.
There's rarely an aspect of community that is just in the community setting that is just like, I'm just putting this out there.
Yeah.
Usually it's like, well, maybe we could try this, or
Yeah.
we could think about doing it this way, or here's some other potential solutions. So it's always this community. It's like community enhanced by
Yeah. Yeah.
some, like you said, like real like street cred
Yeah.
on being able
Yeah.
to do it.
Do you find there's a balance between, typically when people are having problems with something, whether it be a device or just an aspect of their diabetes, they can be very vocal about it. And I wouldn't want to join a community that has just nothing but people complaining
Yeah.
about all the stuff going wrong. Are there elements of balance where you'll have folks come in and say like, I haven't had that problem, or I'm actually having a really great experience with
Yeah.
that device.
Well, it's a great point and great observation. And I mean, you can think about it in a lot of different settings, like even just like if we're engaging with each other and I spend the first like 10 minutes of our conversation complaining, like you're ready to walk away. And so I think that there's this balance of letting people kind of talk about their things, not not immediately problem solve,
Hmm.
kind of like validating feelings and
Yeah, give them some space to be
yeah,
in those.
and you
Yeah,
do that, but that doesn't have to be the only part of it, and
yeah,
it really is not helpful.
yeah.
With either part. So I think that sometimes it's shaping, helping people kind of move to that next part. Like, yeah, this really does suck. This is
Hmm.
really hard. Um, okay, let's think about some things that we can do about it. There
Yeah.
is a way to fix this, and so it's maybe infusing a little bit of hope or optimism, like into
Hmm.
that, like,
Yeah.
complaining,
Yeah.
which I think is a necessary part, but is not doesn't need to go on too long.
One of the biggest values that I got out of connecting with other people with diabetes was seeing different perspectives around similar problems,
Yeah,
right? So if I'm having a problem and I'm hitting roadblocks running into trying to fix it this way, oh, I never thought about approaching it from that angle or thinking
yeah,
about it this way. It's incredibly valuable.
yeah. And there's so many situations, that I think happen for me personally where I just get into my lane, and I don't think about the okay, maybe the reason that I'm not solving this diabetes problem is, I mean, it's such like it often is like a simple observation, but I can't make it because I'm so deep in it.
Hmm.
And I think that that's,
Yeah.
to your point, like that's what's really helpful about community, about having other people. And I know with Blue Circle, and we're like this too with diabetes wise, there's a lot of us living with
Yes.
diabetes, a lot of us, doing this day in and day out, and having professional roles often that
Hmm.
are trying to support people. I think that that's such an important connection. We still have so much more to do with um, equitable access to all these different tools, but I think that we need more of that connection from the teams and employees.
Yeah, absolutely. I'm glad that you brought up the healthcare professionals and those in the field because they need support too,
Yeah,
right? And you guys have built some of that, right? When I think of my healthcare professionals, I never really thought of the fact that they also need to stay on
yeah.
top of all the changing news and the evolving devices and all the best practices and things like that. Tell me a little bit more about what diabetes wise, how you're approaching that.
Yeah, and I think I'm also interested to hear like the from the Blue Circle Health perspective, the connection back after people
Mm,
kind of finish the program.
yeah.
But one of the things that we tried to do is, first it's talking to a lot of HCPs and understanding like what are the main pain points for them, and a lot of times it's things like, the person in front of me with diabetes, like the last time I saw them, they had X insurance. This time
Right.
it's Y insurance. And so it's like constantly evolving landscape, and they can't keep up with it.
Right.
And they have, even with teams and other people that are working on it, and they can't keep up with
Yeah.
not just the devices, but coverage and formularies.
Yeah.
And everything's moved from durable medical equipment to
Prescription,
prescription.
pharmacy. Yeah.
And so I think that one of the tools that we built, and it is a popular one on the site, is a prescription tool
Mm,
where you can this for people with diabetes or for healthcare providers, but it really was intended originally for the healthcare providers, is that you put in, I'm looking for this device,
hmm.
or more broadly CGM. I have this insurance. I live in this state,
Yeah.
and it gives you a report quickly of, yeah, it looks like it's covered. You're going to need prior auth.
Hmm.
Just saving people that amount of time
Yeah.
to have a launch for it has been so helpful.
I can see that
Yeah.
in even my own experience, right? Like it's one of there's already enough roadblocks, or maybe not roadblocks, but speed bumps
Yeah.
along the way, right? And if I can get over one of those speed bumps faster when I'm right there with my clinician, if the clinician is saying, think about this, and I look at it or we look at it and it's not covered at all, right? And we can move on to another option fast.
Yeah.
That speeds things up versus me kind of coming home, getting my hopes up, and
Yeah.
then running into those speed bumps down the road. It's very frustrating.
Yeah. And your team at Blue Circle Health produced this great film that some of us got to see, and I think more and more people will get to see it soon.
Yeah.
But one of the things that's in there, and I think maybe it was Sarah from your team, but just talking about like the number of hours spent
Yes.
talking to insurance companies or fighting a denial. And I think that when it's devices, it's medications, it's all those kind of things. But what I think happens a lot of time for people is they feel like that's the end,
Yeah.
and they don't appeal it. They don't
Yeah.
push back. Like you know, we've been in it long enough, but also kind of know a little bit more about how the system works. Like you always have to push back. You always
Yeah.
have to appeal. You always have to advocate for yourself. And that's, I mean, that's a tough role for somebody who's managing all this, trying to do all the things in their life. And so
Hmm.
if there's any parts of it that our organizations can help to lift a little bit of that heaviness of it, I think that that's
Yeah.
really what we're trying to do.
Yeah, absolutely. You mentioned some of the work that we're trying to do around uh, after someone's gone through the program. How do we help them stay
Oh yeah,
connected? And that's really my primary role is
yeah,
kind of figure that out. And I don't feel like I've been able to figure it out because partly that's a challenging
yeah,
question to answer. It's also everybody is different.
yeah,
We need different things. But the thing that I keep coming back to that's most important for me is I want to find ways for someone who's been through the program after the program to know that there's still someone in their corner rooting for them who cares about how they're doing
yeah,
long term. And it's just such an important piece of it. Some of the things that we're trying so far are group sessions where people can come together and just have some conversations, right? And often there'll be a topic that's planned, but the conversation just
yeah,
goes wherever it needs to go.
yeah.
We're also trying to do things like webinars and podcasts and things like that. And that's definitely no replacement for, a full-on clinical care program or an in-person event or support connection. But it's a step in the right
It
direction,
is,
maybe, and
and
helps
they
us
don't,
learn.
right, and they don't get those things from the traditional
Mm,
clinical care setting, and
yeah.
so we need to add it on. We need to enhance that
Hmm.
as well. So those are great.
It's an ever evolving thing. And part of what is important for both of us that I heard you mention earlier is just listening to the people that
Yep.
we serve. I also feel really strongly about helping the people we serve know about all these great organizations out there and how much we're all working together to just make life a little bit better.
Yeah, for sure.
Yeah. Great.
Yeah. Thanks for chatting.
Always a pleasure,
Yeah.
Corey. Thank you.